We can see it's a boom of AI, of course. It's a tool which helps doctors work faster, better, less mistakes. Very promising industry, and we all see that it can't replace doctors. It helps doctors, of course.
Olga, welcome. As you know, hospitals are overwhelmed and wait times keep rising. Why is healthcare under so much pressure at the moment?
Firstly, of course, it's not enough resources. Not enough resources in hospitals, not enough resources in hospital staff. We all know how much time needed to get a surgeon. It's 10 years or more. And unfortunately, we have situations that more and more people sick, and we just not enough resources to get it in needed condition. So, of course, it's a question of budgeting. It's a question of not always good pointing of resources. We all understand that sometimes it's really important things. And of course, it's now we need more modern ways of teaching students, medical students, more technological ways of working on operational wounds in therapy and so. So actually, now technology is a little faster than industry, and this is a problem.
That leads to my next question. Can technology really fix what's broken in healthcare?
It's impossible to fix everything, but it could give significant boost. In my opinion, and from my experience, what I've seen in cases we worked with, it really helps. For example, modern new ways of studying for students, it helps because, for example, we have situations that quite hard to work on, for example, medical cadavers because we don't have enough cadavers, and some students waiting in queues for practice. But VR cadaver, it's a really good possibility to close this gap. There are a lot of issues. For example, it's ethical issues with this cadaver. It's technological. We need to save it. It's quite toxic thing. But technology really can close this gap. And why not to use it?
And how can digital tools make care faster or more efficient? Can you give specific examples, maybe something you're seeing in your work?
Yes, of course. One of project we are working for our clients, it's immersive training for emergency staff. You understand how tough this work, all these people who work in fields in very, very tough conditions. So it's a possibility to save time for training, save time for being ready for real field work. It's also very important thing to keep team prepared. Of course, it's very good way to share it because, for example, if you have training program, a lot of people can use it because it's very easy to multiply and provide to another team, another hospital, another university the same program. And professor don't have to fly to another country, just working like telemedicine, tele training, and it keep time saving. It's important things.
Let's talk about AI. It's obviously changing the way doctors work. How can it actually help them diagnose or treat patients better?
We can see it's a boom of AI, of course, and there are a lot of ways, and it's a very growing industry. There are a lot of ways and modules. A very interesting way of utilizing AI is analyzing photos. For example, it's MRI scans. Very promising industry, and we all see that it can't replace doctors. It helps doctors, of course.
And you don't see it overlapping with their work in the future?
No, of course not. It's a tool. We have understand that it's not a silver bullet. It's a tool which helps doctors work faster, better, less mistakes. It's also important things.
Can you tell me about VR and AR in hospitals and how these technologies are helping doctors learn or plan surgeries?
Very interesting case. We are working now with Ukrainian neurosurgeon team, and we working for product for VR. It's a pre-operational application which helps team of neurosurgeon be prepared for operation. So actually team, day or 2 days before real operation, making absolutely the same operation but on digital model of real patient. So it helps make it more precise, team is more relaxed, more prepared, and it significantly reduce amount of mistakes and complications. So it's also important thing for this teen operation like neurosurgeon.
My last question for you. As you know, behind most innovations are strong tech partners. What's the importance of collaborations in MedTech?
It's important thing because we are working in like different policies, and very important to find right technical partner, and very important for a medical institution understand that they have to work very closely. So it always exchanging information in real life, and it's very important for tech if you want to get good medical application, good work, and we have worked very closely and with very good feedback from doctors. So it's always like team, but they are in field of operation room, and we are in from our computer. So very important things to be very connected and not afraid to work with technical guys, of course.
Olga, thank you so much for joining me today.
Thank you, and have a nice day.
You too.